Heart palpitations is such a common symptom and syndrome of both perimenopause and menopause. And I get so many questions about heart palpitations. Could it be related? Is it a hormonal issue? And it really scares the bejeepers out of women. So many women end up going to see cardiologists, getting a lot of tests done, running on that treadmill, wearing that Holter monitor, all to find that their symptoms are completely benign. There's nothing wrong with their heart except that they're just going to have those palpitations. So this is something that I want to break down for you and tell you how you can walk through this at home. So if you're interested in learning how heart palpitations can be related to hormonal changes and what you can do at home, this video is for you. I'm Dr. Heather Hirsch. I'm the Clinical Program Director of the Menopause Clinic at the Brigham and Women's Hospital and faculty at Harvard Medical School. And all that means is that I see patients on a consultative basis day in and day out for perimenopause and menopause. And yes, I see so many women complain to me about heart palpitations actually as they're telling me their story and their journey. Sometimes they wonder if it's connected, and sometimes they have no idea that it is connected. And when I build that bridge for them, you see them have this aha moment. Let's first start by talking about why hormonal changes can cause heart palpitations. So again, for a lot of women, they may say, I never had a heart palpitation in my life until I was, 45, 47, 51, right at the time of perimenopause. So your heart is made up of 4 different chambers. And the top of the heart here is where there's something called the node. And the node is actually what causes the signal to go down to the bottom chamber. And you want to have a nice rhythmic contraction every time your heart beats. If that node kind of skips or throws an extra one, you might actually feel this as an extra heartbeat. When you feel that, it's going to scare the bejeepers out of you because one, we're not used to feeling our internal organs. We don't feel our lungs. We don't really feel our heart. We don't feel our kidneys. And so when something visceral happens to us, it can be extremely scary. Now, if you're following along, if something's really scary, like for me, it's when a cop car drives by me, all of your neurotransmitters release all of these chemicals that really put you into that fight or flight mode. That actually, when you have a benign palpitation, can worsen just the entire cycle of the whole process. You kind of get this irregular heart beating, you feel it scares you, and then you're worried it's going to happen again. And that cycle can often continue. Now, estrogen can play a role in how your node at the top of your heart fires. And when estrogen starts to decline, as it does in perimenopause and then into menopause, but commonly this actually happens in perimenopause, it can actually affect the firing of that AV node in your heart. And so perimenopause is a culprit for heart palpitations. I did a great video here with Dr. Daryl Lee Lewis, and we also did a podcast on this. And Dr. Lewis is a cardiologist, in fact, a women's cardiologist. And we talked all about how the changing in estrogen, the hormone that starts to decline when our ovaries start to retire at perimenopause and into menopause, can cause benign heart palpitations. Benign is a word that means these are not necessarily worrisome. Now, anything that happens to your body that you can feel is going to be worrisome to you, but it means that there's nothing that we need to do or fix about your heart. And actually, one of the ways you can improve this symptom is actually step number 1, education and knowledge. And just knowing that the changing in hormone levels can cause heart palpitations and that this can be a very normal and common symptom of perimenopause can help women tremendously. Again, it can hopefully take out some of the stress of what's going on or what could be wrong with you. So the very first step in being able to improve these at home is just the knowledge that this is a normal symptom that can happen to you. And it doesn't mean you're having anything serious like a heart attack or anything more worrisome. Now, of course, it is good to talk to your doctor about it because we don't want to miss something. But if you've already done that thing on the treadmill where you put those leads on and it watches you, or you've worn that monitor at home and everything looks normal, knowing that this is benign and that it can be from hormonal fluctuations is really, really empowering. Next, I want to go over some things that you can do at home just to help stop the cycle or break the cycle of palpitations. So what you actually want to do is try to kick up your parasympathetic nervous system. So your parasympathetic nervous system is sort of the rest and digest versus your sympathetic nervous system, which is the fight or flight. So you kind of want to help get things that are going to turn those nerves on that help you rest, relax, and digest. So a couple things you can do. If you feel an extra heartbeat or a skipped beat, I want you to close your eyes and tell yourself a mantra. This is okay and this is benign. And I want you to take slow, deep breaths. Slow, deep breaths. I want you to bring that nervous system down, calm it down, sit in a chair, close your eyes, clasp your hands. You can even sort of squeeze them. That's actually going to bring blood flow into the core, right where you need it, away from your extremities, like your fingers and your toes and your brain, and bring it back to your heart. So squeeze those hands really tight. Take some big deep breaths and say a mantra. This is normal. This is perimenopause. This is normal. This is perimenopause. That's the first thing you can do after knowing that this is normal. You can also do some other types of yoga poses. If you're someone who likes to do yoga or you have room to just lay on the floor, you can get into child's pose. You could also get into down dog. Some of those poses are just going to recenter you so that you can bring that blood flow to the core, to the heart, and you can slow the heartbeat down and not fire up your sympathetic nervous system. You can also try gently bearing down. And again, those things, just like the clasping of the hands, are going to help bring blood flow to the core. Another thing you can do is a gentle neck massage. You actually have some triggers for the parasympathetic nervous system in your neck. So a gentle neck pressure or massage with some slow deep breaths can also help bring the heart rate down. It can help with the parasympathetic nervous system so those skip beats can slow down. Next, try to figure out if you have any known triggers. Certainly things like coffee, caffeine, or alcohol can be a trigger for these benign palpitations. Sometimes even really strenuous exercise, and that might be a bummer to you if you are an exercise person and that helps calm you down, but certainly all of those things actually up your sympathetic nervous system. It's that fight or flight, gets you really going. But if those are triggers and you know that, definitely try to avoid those or know that that might bring them on. But if you have some calming things like stretching or meditating you could do after, say, you exercise, that can be really helpful. Now, while hormone therapy is not FDA approved to treat heart palpitations, often it can help. And I see this all the time in my clinic. Again, what hormone therapy is going to do is actually help to stabilize or buffer some of your estrogen levels, and it can be very, very helpful at alleviating these heart palpitations. It's miraculous, it's mysterious, but I see it all the time in my clinic. So if you're having other symptoms of perimenopause or menopause, like hot flashes, night sweats, vaginal dryness, you should definitely see your doctor or seek a menopause expert because hormone therapy can be very helpful. Now, of course, there are other medications that can be used to slow the heart rate, but those also have side effects as well. So if we can avoid any cardiac medications, especially if these happen more infrequently, or you've been able to kind of treat your body yourself with some of these mechanisms, that's great. Let me know in the comments if this is a video that was really interesting to you. If you've been surfing the web, if you've been searching for answers on this question, do heart palpitations, can they happen in perimenopause? Is hormone therapy helpful? Let me know in the comments below. Also, for those of you who really want to work with me, who are really interested in hormone therapy, either for perimenopause or menopause, and you feel confused or stuck with your provider, definitely consider joining the Reclaiming Menopause Masterclass. I go through all of this with you. We walk through your symptoms, your medical history, and actually how to best talk to your doctor so that you can get the type of hormone therapy that you will actually figure out that you need right where you are. Click the link in the description bar below. I will walk you through seeing if this is a good fit for you, and I would love to have you as a student, and you also get support from yours truly. Also, if you guys have other tips, tricks, or tactics that you do for your benign heart palpitations that work, also share those in the comments below, because it is really amazing to see this community build and to see women helping each other in their midlife and menopausal journey. Thank you guys so much for watching my channel, for subscribing, for commenting. If you like this video, if you found it helpful, share it on your feed, share it to your social media, share it to Facebook groups you may be a part of, because it's helping to really build this community day in and day out, and I am totally here for it. Thank you guys so much for your support, and I'll see you guys next week for a brand new video. Bye everyone.